Yes, hello there. So you wanted me to make a small video on the Matsen classification. I'll make this video on in English and as well as Hindi. Right, buddies? So you see, this Matsen classification deals with recurrent dislocation of shoulder. Remember, shoulder is the most common joint in the body to undergo dislocation. DL means dislocation, and also it is the most common joint in the body to undergo recurrent dislocation, right? Now, Matsen classification deals with that. Matsen classification deals with that recurrent dislocation. So you see, buddies, Matsen classification will divide the people who have got shoulder joint instability into two groups. So first is tubs. We call it torn loose, and embry. We call it born loose. So basically, this is just an acronym. Tubs and embry, they're just acronyms, the one which you can expand, right? Now, tubs. So you see here the recurrent dislocation. The cause of recurrent dislocation would be a trauma sustained earlier. Now, buddies, for example, I am your patient. Let's say I sustain shoulder dislocation on the right side. Suppose I sustain shoulder dislocation on the right side. So, buddies, most common dislocation, most common direction of shoulder dislocation, let's say, is anterior. Once again, I am your patient. Shoulder dislocation on the right side. Okay, I come to you. You reduce the dislocation by using various methods: Cocker maneuver, Stimson gravity method, Hippocratic method. So you reduce the dislocation. Very good. But even after you reduce the dislocation, the capsule of my shoulder joint, the capsule which covers the shoulder joint, it is a part of mechanism which keeps the shoulder joint stable. So with the initial trauma, my capsule of shoulder joint on the right side in the anterior direction will become loose. So that is torn loose. The capsule became loose after trauma, after first dislocation. So T, traumatic dislocation. Now, after that, I may have repeat recurrent dislocation, and it goes without saying it will be on the side of first dislocation. So if first dislocation was on the right side, there are more chances that second dislocation will also be on the right side, right? Because now the capsule is loose. Okay, so unilateral. Unilateral means on the same side as first dislocation. Unidirectional. If the first dislocation was anterior, my capsule will be weak anteriorly. So next dislocation will also be anterior. That means the same direction as previous dislocation. Now, when there is traumatic dislocation, your patient has Bankart lesion. What is Bankart lesion? Remember, Bankart lesion is the damage to glenoid. Damage to glenoid. And if there is Bankart lesion, surgery is the only treatment. Anchoring. You anchor the glenoid labrum back to the glenoid bone. You can do it by open method or by arthroscopic method, right? Now coming to the next thing there, embry, bone loose. Now this is commonly seen in the people who have got weak ligaments, weak capsule, right? Now this may be due to congenital causes. For example, your patient may have Marfan syndrome. Your patient may have osteogenesis imperfecta. Your patient may have very small, extremely small glenoid. Your patient may have flat head of humerus. So the shoulder joint, which is prone to dislocation. See, it is actually prone to dislocation in all of us. But in some patient, it is much more prone to dislocation because they have got congenitally weak ligament. Now, in these people, the dislocation can be recurrent. It may occur again and again. And buddies, this will occur with trivial trauma. Trivial means minimal trauma. Minimal trauma. Now let's say if I'm your patient who is having weak ligaments, weak capsule, right? So capsule will be weak anteriorly, posteriorly, inferiorly, right? So here the dislocation and recurrent dislocation will be multidirectional. It can occur in any direction, anterior, posterior, or inferior. It can occur on the either side. See, if I'm your patient having weak ligaments, ligaments will be weak on the right side as well as on the left side. So here the treatment would be rehabilitation. We'll tell the patient that you have got weak ligaments. Fine. There are chances of recurrent dislocation. Don't go around running here and there. Don't go around playing contact sports like rugby, like football, where you have chances of falling while running and sustaining dislocation. Let's say we have to perform surgery. So let's say that's a weak capsule, lax capsule. One way is to approach this capsule from the front. Fine. Make a hole like this. Remove extra tissue. And then you make it tight. But what we prefer is inferior capsular shift. Let's say, buddies, this is the head of humerus as you view it from the side. Let's say this is the lax ligament. So you approach inferiorly. Remove the excess of capsule here like this. Right? This much would be removed. Now what you will do is you will stretch this up. You'll stretch this up. Right? How? Like this. Let me just erase it up. You'll stretch the remaining capsule and the remaining capsule will now be tight. That is the surgery. Inferior capsular shift. Compare this result after surgery with the initial ones. See, initially the capsule was like this. Very loose. Now it would be like this. Inferior capsular shift. So there are two named procedures. Putti-Platt operation. What is Putti-Platt operation? Double breasting. Double breasting of subscapularis tendon, and Bristol target operation. That is osteotomy of coracoid process. But as we cut the coracoid process from its original location and then we attach it with the glenoid bone. Let's say this is the glenoid, which is very, very small. So what do? We attach the coracoid process with it. So now it becomes a big glenoid. This is your initial glenoid, which is very, very small. So when you attach coracoid process, now this becomes a big glenoid cavity. This will easily fit the head of humerus. Head of humerus. Double breasting of the subscapularis. Let's say that's a big muscle which is very, very loose. Very, very loose. So what you will do? You'll just cut it midway like this. Fine. Then you'll stretch it up like this and you'll fix it up like this. See, now it has become smaller in size and it has become very thick and strong. Now this will prevent repeat dislocation of shoulder, right? So that was Matsen classification of recurrent shoulder dislocation. Still, if you could not understand, please feel free to send your queries in the comment box. Happy studying. I'll be back with a short video, right? Thank you.